All right, welcome to The Explainer. Today, we are diving headfirst into a real-life medical detective story. A high-stakes puzzle where solving it means the difference between life and death. And the culprit? It's a condition that can look like so many other things, making it one of the toughest mysteries any doctor will ever face. So think about this for a second. Your body is under attack from some kind of infection. Could be a simple cut that gets infected, could be pneumonia, anything really. You'd expect your immune system, your own personal army, to jump in and fight it off, right? But what happens when that army, in a desperate attempt to save you, goes totally rogue and starts attacking you instead? That is the central mystery we are investigating today. The big bad in our story today is called sepsis, and it all kicks off with something super common, an infection. Could be from bacteria, a virus, even a fungus. But what starts as just a small local skirmish can explode into a full-blown civil war raging inside your own body. But here's the thing, and this is absolutely critical. It's not really the infection itself that's the main problem. It's the body's completely catastrophic overreaction to it. The immune system just unleashes this flood of chemicals into your bloodstream to fight, but that chemical warfare ends up causing massive inflammation and damaging your own healthy organs.
Yeah, this is where it gets wild. The very thing designed to protect you becomes your worst enemy. It's like your immune system, which is supposed to be this team of elite snipers taking out specific targets, suddenly decides to just carpet bomb everything in sight. And that collateral damage, that is what sepsis is all about. That's what makes it so incredibly dangerous.
Okay, so this friendly fire situation, it doesn't happen quietly, right? It leaves a trail of clues. The problem is, they're super confusing and can look like a bunch of other things. Following that trail is the absolute key to unmasking our culprit. And the first set of clues often shows up in the body's main command center.
So, one of the first and frankly most terrifying places to show signs of trouble, the body's command center, the brain. When the chaos of sepsis gets to the brain, the symptoms can be incredibly sudden and just deeply alarming.
I mean, this can happen so fast. A person might have no idea where they are, they can struggle with memory, or have real trouble just forming words. In the medical world, they call this sepsis-associated encephalopathy, which is just a fancy way of saying the body's internal war is totally scrambling its most important communication network.
Okay, so after the attack on the command center, the next big clue usually pops up in the body's life support system, the lungs. All of a sudden, breathing becomes a real struggle, and a very important number starts to drop, fast.
All right, so look at this number, 95 to 100%. That's where you want your blood oxygen to be. It's the fuel that every single one of your organs runs on. And when sepsis storms in, this is one of the first numbers to just plummet.
You see, with sepsis, all that inflammation just wreaks havoc on the lungs, and it makes it really hard for them to get oxygen into the blood. And when that fuel supply gets cut off, organs start to fail. This can spiral really quickly into a super serious condition called ARDS, or acute respiratory distress syndrome, where the lungs basically fail and a ventilator is needed just to keep the person alive.
So, let's recap our clues. A confused brain, struggling lungs. But here's the twist in our mystery. Sepsis is like the ultimate master of disguise. Its symptoms can point to a dozen other culprits, which forces doctors to investigate every single possibility.
And this is the huge puzzle doctors have to solve. Is the patient's confusion from sepsis, or could it be a stroke? Or even meningitis? Is that terrible headache from sepsis, or maybe a sudden spike in blood pressure causing the brain to swell? To solve this thing, you can't just have one suspect. You have to rule out all the lookalikes. So, how in the world do our medical detectives sift through all this confusing evidence and finally zero in on the real cause? Well, they break out their diagnostic toolkit, a whole series of tests designed to analyze the clues and build a completely airtight case against sepsis. And the whole investigation follows this really clear three-step process. Step 1, analyze the blood, looking for signs of infection and organ distress. Step 2, get eyes on the inside. Use imaging to take a direct look at the organs that are in trouble. And Step 3, hunt down the source. Find the original infection that kicked this whole thing off.
So here are the tools of the trade. Blood tests can give you huge clues, like high levels of C-reactive protein, or CRP, which signals massive inflammation, or rising lactate levels, which tells you organs aren't getting enough oxygen. Cultures are sent off to the lab to pinpoint the exact germ causing all the trouble. Brain scans like CTs and MRIs can rule out a stroke, while a simple chest X-ray can spot pneumonia. Each test helps eliminate another possibility, getting them closer and closer to the truth.
Okay, so the evidence is in. The culprit is confirmed. It's sepsis. And now there is absolutely zero time to waste. The detective work is over, and it's time for the intervention. A rapid, coordinated counterattack to save the body from its own defenses.
The response is this three-pronged attack. First, and this is job number one, you go after the original infection that started this whole mess. At the exact same time, you gotta support the organs that are failing, especially the lungs and the circulatory system. And finally, you work to stabilize the whole system by fixing all the chemical imbalances the septic shockwave has caused.
And here's the arsenal they use to do it. Broad-spectrum antibiotics get started right away, sometimes even before they know the exact germ. Oxygen, or even a ventilator, is brought in to get those oxygen levels back up. They push IV fluids and special meds to keep blood pressure from crashing. And all the while, the team is doing what's called supportive care, managing fever, controlling blood sugar, just trying to bring some kind of order back to the body.
When you boil it all down, this whole high-stakes mystery comes down to one thing: time. From that very first confusing clue to the final treatment, it is a flat-out race against the clock. The body is literally damaging itself more and more by the minute, and a fast diagnosis followed by an immediate, aggressive plan is the only way to win this fight.
And that leaves us with this really fascinating and honestly kind of unsettling idea, doesn't it? Sepsis shows us this deep paradox in our own biology, that the very system designed to protect us, our greatest strength, can actually become our most dangerous weakness. So it really makes you wonder, in a world where we're always looking for threats on the outside, how do we ever truly prepare for an enemy that can rise up from within?